Dr. Neha.
A very good afternoon to one paper on ocular disorders in children. One of the disclosures affects vision plays a significant role in processing of language, interpreting facial expressions, and developing hand-eye coordination. Uncorrected vision affects physical, cognitive, emotional, and social development of a child and leads to socioeconomic burden on the parent. Many studies have assessed ocular and visual disorders in mentally retarded adults. However, assessment of ocular disorders in mentally retarded children is a challenge, requires a lot of patience and a great deal of ophthalmic instruments. Despite the magnitude of the problem, parents of these children are unaware about ocular disorders, and many of these children never have a visual examination. Thus, this study was carried out with the aim to identify ocular disorders in children with mental retardation and to study the relationship of these disorders with the degree of retardation. This cross-sectional interventional study was carried out after approval from the Institutional Ethical Committee in children less than 16 years attending special education schools for children with mental retardation in a district in central India. Children whose parents or guardians did not give consent, deaf or mute children, and children who did not undergo IQ testing were excluded from the study. Parents were informed in advance and were requested to be present on the day of examination with all previous medical records. The examination process was explained to the teachers. Consent was signed by the parents or the guardians of the child. Teachers and parents were asked to notify if the child had any significant symptoms. Diagnosis of retardation was based on the DSM-4 diagnostic criteria, and IQ was assessed using the Binet-Kamet method. After noting down the child's demographic data, significant history, ocular complaints, and previous refractive error were noted. The child underwent an external ocular examination, following which an orthoptic examination was done. Visual acuity for distance was tested monoocularly, following which the child underwent cycloplegic refraction. Subjective refraction was done in children who were cooperative and responsive. If subjective refraction was not possible, the prescription was based on retinoscopy findings. Refractive correction was prescribed for children who had myopia more than -1 diopter, hypermetropia more than equal to or more than 3 diopters, and astigmatism more than equal to 0.5 diopters of cylinder. After this, the child underwent dilated ophthalmoscopy. Children whose visual acuity did not improve to 618 were termed as visually impaired, and the ones who did not improve to 616, the better eye, were termed as severely visually impaired. Children with signs of vitamin A deficiency, ocular surface infections, and hordeolum were treated medically, and need for low visual devices and importance of environmental modification were explained to the parents. The association between ocular problems and severity of mental retardation was studied by the chi-square test. Ocular problems were categorized according to IQ. Fisher's exact test was used to study the strength of association between ocular problems and mental retardation, and p-value less than 0.05 is considered significant. Out of the 186 mentally retarded children whom we studied, 87 reported ocular problems, accounting to 46.7%. This table depicts the association between severity of mental retardation and ocular disorders. It shows that there is a significant statistical association between the severity of mental retardation and ocular morbidities with a p-value of 0.00172. The risk of getting ocular morbidities among the severe and profound group was 3.76 times higher as compared to the mild mental retardation group. Refractive error and strabismus were the most common disorders, accounting to 41.3% and 19.5% each. In the profound mental retardation group, one child had optic atrophy, another one had congenital anomalies, and another child had ptosis. Amongst the refractive errors, myopia was the most common refractive error, followed by astigmatism, followed by hypermetropia. Only 2 children were found to be wearing spectacles at the time of examination. This table depicts ocular conditions along with systemic conditions. 28 children had epilepsy, 15 children reported cerebral palsy, 11 children had Down syndrome, and 6 children reported speech disorders. 5 of the 11 Down syndrome children reported visual problems. Children with mental retardation have emerged as a group with a need for ophthalmologic assessment. Measurement of visual acuity in these children was a challenge and required patient observation of their eyes, visual attention, and fixation. On comparing our study with other studies, a study from Pune reported ocular problems in 45.3%, and another study from Nagpur reported problems in 51.5% children. refractive error comprised as the most common ocular disorder in all the studies. In the study from Nagpur, myopia was most common refractive error, followed by hypermetropia, followed by astigmatism, followed by strabismus, nystagmus, and optic atrophy as the most common visual disorders. History of perinatal insult was seen in 52.8% children in our study, and a similar study from Pune reported 48.7 children with a history of perinatal insult. The strengths of our study was that cooperation of school staff and parents was the keystone for assessment of the child, and the study gave us a platform for raising awareness levels in the teachers and parents. However, only children who were admitted to special education schools could be examined. Long-term follow-up is necessary to further evaluate visual improvement after refractive correction, which could not be done in our study, and there could be a recall bias in recollecting the perinatal insult. Thus, to conclude, children with mental retardation are often given insufficient ophthalmic care, and the irony is that many of these children never even have an ophthalmic examination. These children should be assessed as soon as the child is admitted to the school, and then an annual ophthalmic examination should be performed. Earlier assessment and correction of visual problems could prevent unnecessary visual impairment and provide maximum potential for the development of the child. Thank you.